So, are you at risk for liver disease? Think about it. It might not be something you ever thought about, but this month is National Liver Awareness Month, so a time to get that conversation going. This afternoon, we have Mercy Health Dr. Johnny Hong with us. And Doctor, thanks for coming in. First of all, walk me through what exactly are the different kinds of liver diseases to look at.
Yeah, good afternoon, Dan. Yeah. So the liver disease has multiple stages. From normal stage, it could progress to what is the dreaded end-stage liver disease, which is pretty much at the end of its function, there, wherein a liver transplant is the only treatment for those disease.
What kinds are they, though? But we talked about the fatty liver was the thing, and then also psoriasis or cirrhosis. There's all kinds of different diseases.
Yeah. So one of the common myth, I would call, that anytime that somebody hears about liver disease, it's associated with alcohol or excessive alcohol intake. Well, although alcohol plays an important factor in developing liver disease, there is a growing disease right now that is non-alcohol related. And the terminology we use, the abbreviation is MASLD, which is an abbreviation for metabolic dysfunction associated steatotic liver disease. It's a mouthful, so we use MASLD. It is prevalent, and it's concerning because 1 out of 3 Americans, so about 100 million Americans right now, have some form of liver disease. And this MASLD, we see this in teenagers to older individuals. So it is important that you have a regular screening with your primary care or a liver specialist to determine whether you have this or not, because an ounce of prevention is worth a pound of cure. And so if you could diagnose this early, you can do a lot of lifestyle changes as well as diet to prevent it from progressing.
Which brings us to, you need to have a regular checkup with a doctor.
Correct.
Get the blood work done, things like that. Get an overall health analysis, and that sometimes early warning signs let you know ways to change your lifestyle or ways that can be treated.
Absolutely. Yeah, that's quite important to start with your regular primary care, and then if needed, see a liver specialist. There are multiple screening tests. Unfortunately for liver, the symptoms does not come in until it's quite late. And so a simple blood test or an ultrasound like a FibroScan, which is a specialized ultrasound to measure stiffness of your liver, will be able to determine that.
In most cases, this is a situation with really any condition of the body. If you treat your body well, if you feed it well, if you're eating right, if you're taking some vitamins, eating the right kinds of foods, then your body should treat you pretty well. Now, I know there's a lot of heredity that can come into these situations that you throw everything out the window, but the liver disease, is it pretty much just strictly in terms of things you have done, or you find that there's liver disease that's actually from your family history?
It's a combination, and there are newborn that would require a liver transplant because of that congenital problem. And so I think it's very important to determine where you stand in regards to the risk factors by speaking with your physician, and then you could sort of modify your lifestyle and your diet in order to minimize your risk of developing this dreaded cirrhosis or end-stage liver disease.
What might be some symptoms you might be seeing if you're not getting your checkup?
Oftentimes, it's just very, very non-specific, like weakness, lack of energy, needing a lot of sleep rather than being active.
Okay, so if you end up having some of those symptoms, check out Perrysburg's specialists there at Mercy Health at Village Square, Suite 200. If more information, also go to the website, because the best thing you can do for that is to get yourself into a doctor ASAP and get checked over and make sure you get a good screening for your liver situation. Dr. Johnny, thank you so much for being here today.
Thank you very much.